Hi, good afternoon. So thanks, Dr. Merle, and fantastic presentation, Pragnya. I think you really nicely illustrated what these machines are capable of. And I'm going to try and talk about whether these machines actually make any monetary sense to incorporate them in our practice. First of all, there's no financial disclosures that I'd like to make in connection with the products that we are discussing here. And I'd also like to say that I've not invested in any of these devices in my practice. For the purpose of this presentation, I have demoed most of the machines that I'll be talking about. And through this presentation, I'll just try to uh, show you the cost benefit analysis of each of these machines that Pragnya has spoken about. So first of all, when do we buy something and when do we invest some money into anything? I'd like to take an example of a rich businessman who in 2006 bought a fantastic yacht and a Formula One team and a beautiful piece of property in the heart of Goa, which everything costed a bomb, but he made most of his money selling beer at 70 rupees a bottle. You could buy anything or you could invest in anything for the fame that it brings you or that the technology excites you or for the comfort that you get by investing in it. But I would buy something only if it makes good business sense. And that's where I'd put my money. So diving right in, I think Lippy View, that is the first and that is the elephant in the room when it comes to dry eye equipment. Uh, it is an expensive machine. You can say that it's the flagship. It can do multiple things. It can tell you the lipid layer thickness. The meibomian gland can be imaged really nicely. And it can also tell you the blink dynamics, whether the blink is partial or it's complete. It costs about 28 lakh rupees. Most centers would charge around 3,000 rupees for a scan for both eyes for the patient. That means that you need to do about 935, 950 patients to break even, and that's about 4.5 patients per week for the next 4 years to actually recover the cost that you put into the machine. If The next would be the Ocular Surface Analyzer Plus or the OSA Plus. This is actually a very nice machine. It looks kind of DIY, as if it's been made at home. Looks a little flimsy. The machine doesn't feel like it has a very good form factor, but costs only 10 lakh rupees. Most centers charge about 1,000 rupees for it, and it can give you meibography. It takes good pictures of the meibomian glands. Not as good as the Lippy View, but still good enough. Apart from that, it also gives you tear meniscus height. Let me just say that the tear meniscus height is something that is really variable. That's what we got. As many times as we would scan, we would just get different tear meniscus height on every different scan. The lipid layer thickness, it works quite well, and you can actually calculate the lipid layer thickness in this. It also gives you non-invasive tear breakup time, and the reporting is in the form of these graphs that we can see, kind of like a scale. I think it's a very good machine and very good value for money, but it feels kind of flimsy. Uh, Another machine by SBM, the same company, which feels a little less flimsy but does practically the same things and automates a few of the processes, like lipid layer thickness is actually calculated automatically, costs about 15 lakh rupees, and you would probably be charging the same to your patients, and you can recover the cost in about in 4 years by doing 7 to 8 patients a week. The next that I will be going on to is the OCULUS Keratograph5M, or a lot of people like to call this the K5. And this is a really cool machine which I liked quite a lot. Why? Because it also adds a topographer uh, to the dry eye components. So it kind of makes up for value in case you're looking to invest into a topographer. It makes a lot of sense that you get a placido disc based topographer, and along with it, you get things such as lipid layer thickness, non invasive tear breakup time, tear meniscus height, as well as meibography. The machine costs about 12 lakh rupees, and you can charge around 2,000 rupees per patient, depending on whether you're charging for topography or for just for dry eye evaluation. That's about 600 patients in total, and less than 3 patients a week. So it makes a good lot of sense. Then I'll be coming down to machines which can do just one thing, which is meibography. The Lippy scan, also by Johnson& Johnson, is a smaller version of the LipiView, which can only image the meibomian glands and costs about 10 lakh rupees. You could charge patients about 1,000 rupees for it. And by doing 5 patients a week, you should be able to recover the cost in 4 years. MeCheck is another similar device, but it looks very flimsy. It looks like a tab that is mounted onto some sort of a camera attachment. It can also pick up some of the, it can also pick up decent images of the meibomian glands. You can charge very less, maybe 500 rupees, or you could just buy it at 2.5 lakhs and use it as a screening tool routinely. So just to summarize all of these equipments, I think the J&J LipiView is a flagship, and there's some amount of snob value with it. And J&J is always known for a lot of bundling. So in case you're a very high volume cataract center, or you have a lot of things of J&J going on, it might make sense to you. SBM's OSA Plus and IDRA, these are both machines that are nearly equally capable. They are both excellent machines in terms of the reporting. You can get a lot of information, but both of these machines are really time consuming. So to actually be able to get all 4 or 5 of the parameters that it's measuring, it takes about 25 to 30 minutes. You're going to need a technician who you're going to train to do this. Otherwise, your clinic is going to get disturbed quite a lot. And I think in terms of functionality, there's not much difference between the OSA Plus and the ITRA, but there's a big difference in the cost. The keratograph by Oculus, I think the dry eye aspect of it seems kind of weak. It doesn't do that very well, but the topographer makes up for it and makes it good value for money. The LipiScan and MeCheck is just for addition, in case you don't want to get into dry eye, just want something that can take a good picture of the meibomian glands. That is probably it. I think it would be incomplete to talk just about imaging here and miss out on the possible treatments. And so I'm just going to touch upon LipiFlow, which is a really nice, effective way of
So
delivering
Ritin,
hot
you have
compresses and massages.
sorry
And
to interrupt
massage.
you. You have a few seconds
I'm
to
sorry.
sum up. You have a few
Yeah.
seconds to sum up.
Sure, ma'am. I'll finish in about 30 seconds. So the LipiFlow is just a very good sort of warm compress or a lid massage, and the IPL or other or in a couple of machines can also do similar things for myomitis. Or you could just prescribe some sort of hot compresses with pads. So I would think that the reason why I'm not so much invested in this is because the therapeutics and diagnostics, even though they go hand in hand, but they're not connected to each other. I mean, you could defer payments, you could have good bundling options, and incorporate diagnostic devices as screening tools in your practice. But that's something that I've not done. The reason for that is that you have patients who are symptomatic, and you get some objective measurements by imaging, and you have treatment, and this is this cycle, and then you see improvement, like in the form of an OCT, where you have patients with metamorphopsia, you see macular edema, you inject the patient, and the patient's retina actually becomes normal and the symptoms go away. This sort of triad is not experienced with dry eye. The treatment aspect really doesn't show an improvement in the objective measurements. And that is probably why I'm not invested in one of these machines. Large volume cataract centers where most of your patients pay very well. You want a competitive edge
Sorry to
over your.
interrupt, Dr. Ritin, but
Yeah,
I
this is my last
request you
slide.
to please conclude in 30 seconds.
Yeah. So if you want a competitive edge over your peers, you're convinced that the therapeutic modalities are going to work, and you're invested heavily in the bundling ecosystem, and you think that your technicians are going to be able to handle patients on their own and be able to give you good reporting, I think you can go in for this. Thank you very much.